Okay, that's it. Sorry.
If you ever overheard somebody saying to someone else, I just watched the movie Luck and Cherry. I mean, Chuck and Larry. Most people would not think anything of it. They would just think that they had just heard a normal conversation. Funny, but normal. Most people would not have realized that what they may have actually just heard was a sign or symptom of a learning disability called dyslexia. Dyslexia is a learning disability that needs some awareness. Much of the information I am going to share with you today came from the Mayo Clinic website, the Learning Disability Association of America website, and the Dyslexia Center of Utah website. Dyslexia affects a wide range of people. According to Dyslexia Center of Utah, 70 to 80% of all people with reading problems most likely are dyslexic. The website also states that the percentage of adults that have reading problems read only at the lowest reading level. And the 62% of non-readers drop out of high school. And then you will see the percentage of men to women with dyslexia are about equal. It is also the same for different ethnic groups and economical backgrounds. Today, we will discuss the definition of what dyslexia is, the signs and symptoms of dyslexia, and treatment and testing for dyslexia. Let's begin with the question, what is dyslexia? According to the Mayo Clinic, the definition of dyslexia is as follows. Dyslexia is a learning disorder characterized by difficulty reading due to the problems identifying speech, sounds, and learning how they relate to letters and words. It is also called specific reading disability. Dyslexia is a lifelong condition that is caused by inherited traits that affect how your brain works. Although there is no cure for dyslexia, there are treatments to help control it and to help you succeed in school. Next up are the signs and symptoms of dyslexia. Dyslexia occurs in people of normal intelligence and vision. Dyslexia also may go unrecognized for many years and may not be noticed until late adulthood. Here are some examples of signs and symptoms from the Learning Disability Association of America. They read slowly, has trouble with spelling, may have difficulty with handwriting, exhibits difficulty reading known words, and has difficulty with written language. And now, but not least, testing and treatment for dyslexia. There is no one test to diagnose dyslexia. Your doctor or your child's doctor may consider a number of factors such as development, educational problems, medical history, and home life. Questionnaires and testing of vision and hearing, as well as neurological and psychological tests, may also be performed to help diagnose. Dyslexia is treated using specific education techniques and approaches. The sooner the treatment starts, the better. Psychology testing will help in developing a suitable program for treatment that works best for the individual. Some example of educational techniques and approaches are provide a quiet area for activities like reading and answering comprehensive questions. Don't count spelling on history, science, or other similar tests. Allow alternative forms for book reports. Present material in small units. And use books on tape. So now we should all have more awareness about dyslexia. We can clearly see that awareness of dyslexia is an important and worthy topic. Dyslexia is a worldwide problem that can affect 1 of every 5 people, which most likely means that you probably know someone who is dyslexic. Now, after hearing all this information, maybe you will help spread awareness about dyslexia too.